Good day. I'm James Thomas O'Donnell, and the topic today is drug allergy. Are you allergic to any drugs? Do you have any drug allergies? These are questions that every physician, nurse practitioner, physician's assistant should ask every patient that they're considering prescribing a drug. Every pharmacist should ask this question for every patient who's getting a prescription filled, and every nurse should ask this question of every patient to whom they're giving or administering a drug. These questions can save lives. Serious drug reactions can kill patients. Compliance with these rules of getting the information, asking the question, posting the information on every medical chart, bedpost, physician's order sheet, medical administration record, a physician's and pharmacy profile is a precaution that can help avoid serious drug reactions. So what is a drug allergy? A drug allergic reaction is a reaction of the body to a drug. The body forms what are called antibodies to a specific recognition of a drug. The drug indeed acts as a antigen or hapten, and an antibody-antigen complex forms, and it causes a reaction in the body. That first type is a minor reaction, such as itching or rash, and indeed, if itching or rash occurs, that information needs to be transmitted to the pharmacist or the physician, and they make a decision whether you should stop the drug. Definitely stop the drug if you manifest an initial allergic reaction to it. More serious reactions occur when further biochemical reactions happen in response to the formation of this complex, and they're called serious allergic reactions or anaphylactic reactions, or there may be a complete drop in blood pressure, cardiovascular shock, or filling up of the lungs with fluid, pulmonary edema, or the swelling of the face, the lips, and the tongue, such that you can't get any blood pumped, you can't get any air in your body, or you can't get any air in your mouth as a result of this severe reaction. And that's called an anaphylactic reaction. And almost every drug has been reported to cause anaphylactic reactions. So that the first time an allergic reaction occurs, it's usually minor, but there is great import to that, in that it needs to be transmitted, and it needs to serve as an early warning, because we don't want to give the drug the second time. That becomes a contraindication, which means don't give the drug again. The risk of that serious allergic reaction outweighs any benefit that the drug can cause. So part of this is what are not allergic reactions. What reactions are not allergic? We can get sick from drugs, and they're not all allergic reactions. Allergic reactions can occur with any amount of drug. Toxic or other side effects occur based on a greater propensity or greater risk the higher the dose of drug. And those are the most common, and they're perhaps might be considered nuisance, are the gastrointestinal effects, heartburn, nausea, vomiting, diarrhea, constipation, dizziness, lightheadedness, drowsiness. These are all, they may be serious, but you call your pharmacist or your doctor, they may tell you, okay, well, take that with food or avoid certain foods, enhance and further the warnings that come with the prescription. So again, not all reactions are allergic, and just because you've had those side effects doesn't mean you're allergic to them. So how do we help avoid serious toxicity from allergic reactions? Again, we teach patients that they are to recognize reactions. Call us if you have a rash or itching. Don't use the drug in a patient who has such a history, and select drugs that have the same beneficial effect but are not in the same class because, as I said, drugs with similar chemical structure may cross-react. Penicillins cross-react with amoxicillins and ampicillins and other cillins. They also can cross-react with another group of antibiotics called the cephalosporins, not because of the same chemical structure, but rather they have a core ring in the structure that is the cause of the allergic reaction. And also there's a cross-reactivity that occurs between drugs in certain classes. The most common is the NSAIDs, the non-steroidal anti-inflammatories. You probably know them better as Motrin or ibuprofen. Well, if a patient is allergic to Motrin or ibuprofen, they're also allergic to aspirin or Aleve or diclofenac, any drug within that NSAID class. So that's the message today for drug allergy.